Hello, and welcome to today's 101 Thoughts podcast. I'm your host, James Damboiu. Today, I will be speaking with Dr. Cindy Leung, a researcher in nutritional sciences at the University of Michigan. We will be talking about current trends in nutrition, food insecurity, and health effects related to excess sugar consumption. Without further ado, let's get started. All right, I'm really glad to have you on today. Really appreciate it.
Yeah, I'm happy that this worked out.
Yeah, thank you. So I guess let's get started then. So tell me a little bit about yourself, like what kind of research you do, the populations and demographics that you work with.
Well, I am an assistant professor in nutritional sciences in the School of Public Health. I am a nutrition epidemiologist, and so I study the links between dietary intake and chronic disease. And a lot of my research also focuses on health disparities. And so trying to understand how factors that predict dietary intake could then also impact different rates in chronic disease. And especially I have a focus on food insecurity. So, food insecurity is a prevalent and persistent problem in the United States and affects everyone at different stages of the life course and has been associated with a number of health outcomes. And so a lot of my research is trying to understand the different mechanisms for why food insecurity impacts health, and then how we can use that information to understand policies and interventions to both address food insecurity and diet-related health disparities. So, that's a little summary about my research. But, as a nutrition epidemiologist, I'm also just really interested in research that continues to show how what we eat can impact our future physical and mental health.
Very interesting. Thanks. So, what would you say sparked your interest in this field?
In nutrition?
Yeah.
Well, I think I've learned from a young age that I was really interested in food and how the study of food is related to health. I remember learning about the food pyramid when I was in elementary school and learning about the different food groups and how you're supposed to package different types of food groups in your diet each day to maintain a healthy diet. Come a long ways from those like original food guide pyramids where carbohydrates was at the bottom and fat was at the very top. I think our knowledge about diet and nutrition has continued to evolve. And with epidemics of obesity and diabetes and food insecurity in the country, clearly there's a lot of room in public health for us to work to improve diet and healthy eating behaviors at the population level. And I think that's continues to drive my interest and my research in this area.
So since you brought up the food pyramid, like at the very beginning, just out of curiosity, how has it changed, if I may ask?
It's changed quite a lot. I mean, it's not a pyramid anymore. Right now, it's a plate. It started off with just a basic infographic on the different kinds of food groups, and then it transitioned into a pyramid in the early 90s. And it stayed a pyramid for a while. At one point, the pyramid stopped having food on it, which wasn't very helpful. At some point, they pivoted more to physical activity. So it was like a pyramid and a stick figure running up the pyramid, try to promote staying physically active, which is important, but people don't go to the food guide pyramid to learn about physical activity. And now it's a plate, which shows kind of when you sit down and have your plate should be portioned into different food groups, and your beverage should be on the top right. The pyramid has changed a lot, and not just the image, but also the guidelines that it recommends. When I was a child, the pyramid was very focused on high carbohydrates and low fat. That is what our nutrition knowledge informed us at the time was supportive of healthy eating. And we've realized that is no longer consistent with what we know. And so now the current My Plate, as it's called, which is developed by USDA, has the plate as half being fruits and vegetables, and then another quarter or so being meat, poultry, fish, or other protein sources, and then another portion being whole grains or grains with at least half being whole. There's still some flaws with the plate. Obviously, because it's based off the dietary guidelines, there is some industry bias in terms of which foods and food groups get more heavily promoted. And so a plate that I like to use a little bit more when I teach or when I talk with friends and family about healthy eating is I go to the Nutrition Source, which is a website that's maintained by the Harvard Chan School of Public Health. And that website has its own version of the My Plate, except it promotes healthier versions of each of those food groups. So for example, the meat section would tell you to avoid red or processed meats, focus on plant-based sources or poultry or seafood. The grain section would be whole grains only. The vegetable section would discourage white potatoes, but encourage more leafy green vegetables and orange vegetables. So, every food group has kind of like those recommendations that not all foods in the food group are created equally. And I wish the USDA version of the My Plate would meet the Harvard version a little bit better, but I understand, the reasons why those differences can exist.
Yeah, well, thank you for explaining that. I was curious because I remember I've seen the food pyramid when I was in early elementary school, but then later on by like fourth and fifth grade, it disappeared. So it makes me wonder what happened to it. So, what would you say is something that you really enjoy about conducting research in this field, like studying food insecurity and all that?
So for me personally, I think the process of scientific inquiry is an amazing journey, and it speaks to the process of hypothesis generating and data gathering and statistical analysis, and then ends with translating findings for public health messaging and health communication. So I find that entire process really fascinating. And it's sometimes when you tackle a new research project, it's like solving a puzzle and you don't know what it's going to be in the end, but you're committed to the journey. So, for me, that's why the field of research in general is satisfying and rewarding. But I would say the topics that I choose to do research in are also are selected because of the implications for public health and policy, social justice, health equity, and all of the above. Because it's not an equal playing field. If you go to the grocery store, things are placed for a reason, and everywhere from anyone from the food group or the food manufacturers, the grocery stores themselves. There's a lot of stakeholders that get to decide and shape our food environment for reasons that are outside of the general consumer's knowledge. And so there's all these cues in our environment to try to get us to make the unhealthier choices, because that's frankly where the money is at. It doesn't help that there's not a lot of funding for carrots, but there are for Cheetos. So we're unconsciously making food decisions that are guided by people who are not always in our best health interests. And I think my research is one, trying to elucidate, if you experience food insecurity, how much more difficult is it to feed your family the foods that you want, to access the foods that you want, or to maintain your health when you have limited financial resources to purchase healthy foods. And then two, how do we create a healthier environment so that more broadly, any shopper, any consumer who goes into a grocery store, who goes into a restaurant, who goes to a coffee shop, doesn't feel like they have to make the unhealthy choice, because that is the expectation and that's the norm and that's the culture, because they can make the choice they want because it's what they want for themselves. So that's why I do the research that I do.
Mm-hmm. Yeah, thank you for explaining. So you feel like your work helps other people? That's one of your motivations?
I would say that, and I would hope that it's more at the population level, that it helps populations be able to engage in healthier behaviors if that's what they choose.
Okay. So after that, switching gears, what would you say is one of the hardest parts of research in this field?
I think one of the hardest parts for me is trying to is having to say no to some projects just because I have limited time during the day, and there's a lot of really interesting questions that are coming through the field of nutrition. I would love to tackle all of them, and unfortunately, I have to turn several of them down because I just don't have the bandwidth to conduct them. So to give you an example, like right now, our field is very interested in sustainability. How do we promote diets that are good for the planet and not just good for our health? And actually the diets that are good for our health are also good for the planet, but trying to figure out like what kinds of messaging would encourage someone to make the food choice that also benefits the planet. I think that's fascinating. And there's a lot of research around greenhouse gas emissions and different food sources and how, their different climate impact. And then for me, I'm thinking about for populations who experience food insecurity or have other kind of like social needs, what would be their motivation to try to eat a more sustainable diet? So, those are just examples of questions that I would love to answer one day, and I can see our field kind of moving in that direction. But it's hard when you're limited to 24 hours in the day.
But yeah, I mean, one step at a time. So I have another question then. You mentioned food insecurity a lot. Could you explain that?
Sure. So food insecurity is defined by the USDA as the limited or uncertain availability of nutritionally adequate and safe foods, or the limited ability to acquire these foods in socially acceptable ways. So it's basically a social and economic condition where a household or family isn't able to afford enough food to meet all the needs of everyone in their household. It is not, sometimes we use it interchangeably with the word hunger. Hunger, I think of more as like a physiological sensation. It doesn't always stem from financial or social needs, but food insecurity does. And we know that food insecurity is tied to structural inequities in health, classism, racism, and we've had just persistent levels of food insecurity in this country since we started measuring it in the 1990s. And so with the COVID pandemic, there's definitely been more interest in understanding how food insecurity is changing because people were losing jobs. Their kids were home from school, so their childcare was gone, or they were having their wages cut. So we were definitely seeing higher levels of food insecurity during the initial months of the pandemic. And then seeing how the government has responded to rising economic and food insecurity has also been really eye-opening because we can see that food insecurity changes. It fluctuates rapidly when you have a stimulus payment or when you expand SNAP or food stamp eligibility. So seeing how like these policy interventions can directly alleviate food insecurity has been really heartening and shows that we need stronger policies long-term, sustained beyond the pandemic to try to bring that level down to zero. A lot of people think that we shouldn't have food insecurity in this country because we are so food and resource rich, right? But the fact that food is not going to certain parts of our population, and we have like 1 in 10 families or 1 in 8 families with children experiencing food insecurity is egregious, and it just shouldn't be happening because it's connected to a number of health outcomes. So trying to understand policies and programs that can better serve to improve food insecurity and improve health is a big part of my research.
And so part of food insecurity would also include not being able to eat healthily, like you can obtain food, it's just not good food.
So if you think about how our foods are priced at the store, oftentimes the foods that are most heavily marketed and then promoted and discounted tend to be the ones that are convenient and highly or ultra processed. It takes more resources, a whole raw chicken and vegetables and spices and oil and like cook a meal at home than it is to just get a bucket of fried chicken or to get like a frozen pizza. And it's a source of frustration for a lot of families who are feeling their wallets tighten when they get to the grocery store. So even if you compare something as simple as the price of orange juice, the price of Sunny D, it's much cheaper to buy Sunny D for your kids. And if if you have multiple mouths to feed and they're constantly asking for something to drink, it can be really stressful to think like, well, I want to buy them orange juice. It has more vitamins. Clearly it's better for them. It has less added sugar. But then the Sunny D, I can buy 3 of those for every 1 jug of orange juice. So these are decisions that people make every day at the grocery store. And it comes at a price for the children's health and also for the parents' mental well-being.
Very interesting. So, how do you think that dietary quality has changed over the past several decades, and why?
Are you speaking at a population level?
Yeah.
How has diet quality changed? It hasn't changed too much, to be honest. For the most part, Americans don't eat that well, and there's a lot of room for improvement. So that's why there's so much research being done in my field to try to see how we can keep moving the needle. So in general, and this is true like across the last few decades, fruit consumption has been very low, vegetable consumption has been very low, meat consumption, especially red meat and processed red meat, have been fairly high. Not a lot of people consume plant-based sources of protein like tofu and beans. Not a lot of people eat seafood, even though we know that seafood consumption is protected for heart disease. And then, mostly our carbohydrate consumption is refined. So white pasta, white bread, and not so much whole grains. I'm seeing a lot of shift at the grocery store, like more products available that do incorporate whole grains or are more like, with like this new shift in plant-based meats. There's a lot like Beyond Meat and the Impossible Burger are trying to appeal to these meat eaters to try to reduce their actual meat consumption. So I think the trends are going in that way, and I think these trends are being adopted by like smaller groups, not like certain individuals, but we're not seeing those changes at the population level where we can say like, yes, we're finally eating like the recommended number of vegetables in this country. It's like, no, we still have a lot of room to do to improve.
Mm-hmm. But yeah, that's fascinating because I'd always thought or assumed that dietary quality has declined, but it's the same then, right?
So I would say that dietary quality has improved for people who are high socioeconomic status. So that means they have high income or high levels of education. Like they have all the resources to be making these changes to their diet. They can shop at Whole Foods. They can afford to buy organic foods. They have the resources to and the time to cook these different items or to learn how to cook these different items. And what our research has shown is that the low and middle socioeconomic status groups have basically not really changed. So, all these public health messaging campaigns that we're doing to eat 5 a day or to eat the rainbow or to drink water, not soda, it seems to be it's like the more resource rich people who are able to make these changes. So we have to think of more novel interventions for the low and the middle socioeconomic status.
Very interesting. Yeah, thanks for explaining. So right now I'm going to switch gears a little bit. One publication that I believe you were involved in that caught my eye was about the effects of sugars on cell aging in leukocytes. Apparently, it can cause shortened telomeres. Could you explain those results a little bit more? I find it fascinating.
Sure. So that was a nationally representative study that I led. That paper was published in 2014. And basically, we used data from the National Health and Nutrition Examination Surveys, what we call NHANES. NHANES is administered by the CDC. And so it is this national survey where they collect a ton of information on demographics and health behaviors. They collect blood specimens from most participants who consent to providing their samples. They measure their height and weight. There's a lot of health information being collected. It's all publicly available. And so when I worked on the study, one of the collaborators was Dr. Elizabeth Blackburn. Dr. Blackburn actually won the Nobel Prize for discovering telomerase, which is an enzyme that can lengthen telomeres. So telomeres are the caps at the ends of your chromosomes. They promote chromosomal stability. And when telomeres get too short, so they naturally shorten over time. And when they get too short, then the cell can malfunction and die. So trying to understand how we can maintain telomere length has been important, and telomeres themselves have been associated with, short telomeres have been associated with a higher risk of diabetes, cardiovascular disease, and even mortality from several of these conditions. And so when I was working on the study, the senior author was Dr. Alyssa Eppel. Her whole body of research has shown that stress, chronic stress, can shorten telomeres. And so she connected with me because I study nutrition, and she wanted to understand how nutrition, or specifically sugar sweetened beverages, might be associated with telomeres, because some of the same processes that we think are associated with telomere shortening, things like systemic inflammation and oxidative stress, those are induced by sugar sweetened beverage consumption. So our hypothesis was that drinking sugar sweetened beverages would be associated with shorter telomeres. And we used this nationally representative sample because it was a large group of people and everyone had their telomeres measured, and they all completed these really extensive dietary recalls so we could understand what they were eating. And basically what we found was that drinking sugar sweetened soda, so carbonated soft drinks, was associated with shorter telomeres after we adjusted for demographic factors like age, sex, race, education, and also some behaviors like smoking. So all of the things that we accounted for were things that were known to both influence soda and telomere length. And even after taking those factors into account, we saw that drinking regular sugar sweetened soda was associated with shorter telomeres. And I think it was on the effect of like a 20-ounce bottle of Coke would be associated with 4.6 years of additional aging. And that magnitude was similar to what we saw in another study that compared smoking to telomere length. So they had found a similar magnitude. And then on the flip side, there's a study that looked at physical activity and telomere length, which was protective. And so it was also like, protective, but on the same order of about 4 years of biological aging.
So you mentioned like obesity and diabetes as possible consequences of telomere shortening. Are there anything else? Any other disorders that you think could be caused by cell aging?
So telomere length is a fairly new biomarker, and there's a lot of studies right now to try to understand, is it predictive itself of certain health conditions? And if so, why? So the ones that have kind of the greatest amount of evidence are things like short telomeres are known to increase the risk of cardiovascular disease, diabetes, and also some cancers, and also higher risk of mortality from some of those conditions. There's studies in the field right now that are following people over time to look at how their telomeres are changing and how that might affect future risk of disease.
Yeah, I was just curious because I feel like this is something that could like have a wide range of impacts. Definitely. All right. And now, as we're nearing the top of the hour, I told you I did a systematic literature review on artificial sweeteners. I'm just curious, what are your thoughts? Do you feel like some of the controversies are overhyped, or do you think that maybe they could be a solution to the obesity epidemic?
So there's a lot of different artificial sweeteners, and I would say that the consensus in the nutrition field is that artificial drinks, beverages with artificial sweeteners are a healthier substitute for full sugar sweetened beverages, but they are not as healthy as drinking water, plain water, or unsweetened options. There is a thought that just drinking something that's sweet, artificially sweet, because oftentimes the sweeteners are, multipliers more sweet than regular sugar, that it conditions the taste so that people tend to crave sweet foods. And so, if we were to follow like a traffic light system, which there have been labels designed for, to help people decide what beverage to pick, the sugar sweetened beverages we would definitely put in the red zone. So, try not to drink these or drink them in smaller quantities. Drinks with artificial sweeteners we categorize as yellow, choose in moderation. And some of the long-term health effects are still unknown. I would say the evidence is much more clear for sugar sweetened beverages, that they are more harmful, but that's not to say that like artificially sweetened drinks are completely safe. And then the green drinks would be things like plain water, plain coffee or tea, because those tend to be the ones that are the best replacements for someone who's trying to drink less sugar sweetened beverages.
Yes, thank you for explaining. So you mentioned the warning labels, and I actually read an article from the School of Public Health about a study that you did with Julia Wolfson about putting labels on drinks on university cafeterias. Do you see such a system being implemented like on a broader scale, like at grocery stores or elementary schools?
Yeah, so we did that study 2018 to 2019, and it was the longest running real world test of a sugar sweetened beverage warning label that I think has been published. Of course, that may change in the next year, but it was really interesting to see the results. What we found were that the warning labels helped students to reduce their consumption of sugary drinks that were not soda. So things like pink lemonade and the sweetened teas and sweetened, just like the drinks that were not as obvious, I think, that are full sugar sweetened beverages that were available in our dining halls. And it's promising because it's not an expensive intervention. It was easy to implement, and we got a lot of buy-in from our stakeholders, like people at M Dining and people in the School of Public Health. So, it's a step in the right direction. Whether or not this is going to be implemented in restaurants and grocery stores, I think it's an uphill battle because the soda and beverage industries are so powerful, and they have a lot of money to be fighting against any kinds of interventions that would reduce consumption of SSBs. So, from a public health standpoint, warning labels are one of the tools that we have to try to promote healthier beverage consumption. Before I came to Michigan, I was at UC San Francisco, and I was part of the group that was leading the evaluation of the Healthy Beverage Initiative. It was an institutional sales ban, basically, of sugar sweetened beverages. So any eatery or any like cafeteria, or even at all the patient menus, you could not get a sugar sweetened beverage. You could go off campus and buy one, but you could not order one on campus. Michigan Medicine already has that policy as well. And so, that's another kind of policy, having a sales ban at a school or at a workplace. We know that's effective because it means that if you really want one, you can go get one, but it's just not readily available. And then soda taxes are another promising strategy. And I have great colleagues who are evaluating local soda taxes across the country, showing that they not only work, but they reduce disparities in SSB consumption, and they generate money for obesity prevention campaigns. So, warning labels are just one of the things that we have to try to use to try to combat all of the opposite strategies that the industry is putting up to try to get people to drink more soda.
I've once heard of conversations of putting taxes on sugar saturated foods, and some people who I've talked to didn't like the idea. They didn't want people or someone else interfering with their diet choices. Though at the same time, there is a crisis, the current obesity epidemic. So I feel like something should be done. It's in everyone's responsibility to pitch in.
It absolutely is. And a sales tax isn't saying, or sorry, it's not even a sales tax, it's actually an excise tax, which means it's a tax on the distributor. The distributor, the store itself can choose to absorb the tax if they have the means to do so, or they can pass it on to the consumer in the pricing. And so it's not, and I mean, we tax things like tobacco, we tax alcohol. So, soda isn't that far off. The argument about limiting personal choice or having some, public health tell you what you can and can't do is the same argument for seatbelts, the same argument for smoking. These are health behaviors that we have really strong evidence to show that they are causally linked to diabetes, to obesity. And these are dual epidemics that huge, like millions of people are experiencing at the same time. So the whole point of public health is to try to make a healthier environment so that the default choice is the healthy choice. And that's partly why we're doing these studies on warning labels and sales bans and taxes, because some suite of these policies will work. We don't know what the magic solution is, and but the industry is telling us all the time how we should be eating. We're just kind of oblivious to it if we're not paying attention.
Mm-hmm. Yeah, thanks. So I do have, I guess, a couple more questions. It is past 5 o'clock. Are you able to stay a little bit more, or do you have to get going?
I can stay for a couple more minutes.
Okay, yeah, thank you very much. So you talked a little bit about the direction that your field of research was going in, studying more about food insecurity. So what are some projects that you're working on right now, if you could share?
Oh, what are some projects I'm working on?
Yeah.
I have a couple projects related to food insecurity among college students at the university. College student food insecurity was kind of an invisible issue for a long time because a lot of people just couldn't fathom that college students would be food insecure. I mean, if you can pay your tuition and you live on campus and there's dining plans, how could someone on our campus possibly be food insecure? And so I've done several studies now to understand the prevalence of food insecurity, how that relates to diet and other health behaviors, as well as academic achievement. And everything is kind of as expected, unfortunately, that we have a high prevalence of food insecurity. We know that students from underrepresented minorities, first-gen students, tend to be more at risk of food insecurity. Food insecurity associated with poor diet, higher BMI, lower GPA. And outside of U of M, we've done some national studies that showed for people who are food insecure during college, they have lower overall educational attainment, so they're less likely to graduate or go on to get subsequent degrees. They're also more likely to be food insecure in early to mid adulthood. So we know that it kind of tracks through different life stages. So that's an ongoing project of mine. I have some students who are working on the intersection of food insecurity, disordered eating, and food addiction. So just trying to understand the psychology of food insecurity and how if you are continuously deprived of the foods that you want to eat, not because of self-imposed constraints, but because of financial constraints, how does that shape one's perception and relationship with food? And there is emerging research to show that food insecurity is associated with eating disorders. And so I have talented students who are working on that area. And then I'm also interested in food insecurity and cognition. We know that in children, food insecurity is associated with lower cognitive development. And just thinking across the life course, food insecurity, cognitive function is really important in older age because the higher your education and your ability to have healthy cognition, the more protected you are from Alzheimer's disease and other dementias, which is highly prevalent in our country. So trying to understand the relationship between food insecurity and cognitive impairment and dementia is another area that I'm interested in.
Mm-hmm. Absolutely. And then my final question for you, before we wrap up, is do you have any tips to offer those who are aspiring to enter the field of nutritional sciences?
You mean as a researcher or as a practitioner?
As a researcher.
As a researcher, I think, one of the best things you can do is to talk with faculty and learn about their research, read papers that are of interest to you, and just get a sense of like where the field is going. A lot of researchers, colleagues that I have, and at the school, we welcome student volunteers, people to help us conduct research at different stages. And that's a great way to kind of get your foot in and see if like research is right for you. And so I think trying to identify what part of nutrition someone is interested in is helpful. In my department, we're fairly small. There's only 13 of us on primary faculty, but we have a huge range of interests and research topics and laboratories. And so someone's interested in wet lab research or like doing macronutrient metabolism or micronutrient metabolism, all the way to like global food systems. What part of nutrition is most interesting to you and why? And then, what kinds of research skills do you want to gain? Those are all like great starting conversation topics when you meet with faculty.
Mm-hmm. Yeah, very nice. Thanks. That's something I'll think about, especially for myself, because research is something that I'm thinking of doing myself too. Anyways, once again, I really appreciate you for coming on. It was really nice to talk to you. Mm-hmm.
Yeah, nice to chat with you too.
Yeah.
Thanks
Hope
for
you have a
this.
great
Those were
weekend.
great.